you might not know about me is that I'm a big fan of Jimmy Fallon. I really love Elton John, and unless you knew me really well, other than the scars on my breast and the fact that my eyebrows never fully recovered, I'm also a cancer survivor. So I had been through breast cancer a couple of years ago, and what happened to me was that I've become known as a patient advocate or a personal advocate for cancer, and I like to think of my journey in really two different parts of it. The diagnosis up front, and then the part that became advocacy. Really, both parts of the journey were unexpected and unplanned events in my life. I think for most of us, nobody expects to have cancer, but for me, I really didn't expect to have cancer when I had cancer. I was 34 years old. I had no family history of cancer, let alone breast cancer. And then after those two pieces came together, everybody said to me, well, then you must have, have the BRCA gene. You must have the genetic testing done, because for sure that's the reason why you have breast cancer. I went through the genetic testing, they rushed that through, really just to confirm that that's why I had breast cancer. And I remember I got my test results, and then I walked into the oncologist's office and I said, well, I got my test results, and he said, yes, I don't have the gene. He said, well, what do you mean? I said, I don't have the gene. He said, I'm not a betting man, but I put money on that one. I was certain you had the gene, and I didn't. And I think that's really where my journey started, was because something didn't make sense here. So I had all of these uncertainties as to why I had cancer at all. And if I learned anything in my life, I had spent, a number of times going to the hospitals and doctor's offices with my father, who had been through the system. You don't get anywhere unless you ask questions. And that's when I started to put this story together as to what was going on. So advocacy isn't really something that you intend to go into. Advocacy is a lot of times something that happens because you're asking questions. So for me, really, all I really did was started to go to my doctor's appointments with pen and paper in hand, asking questions. I remember the first meeting I had with my surgeon, and this is where I really started to realize how much onus was on me, was, he told me I have breast cancer, and then he said, okay, lumpectomy or mastectomy. And I'm like, what? I can't even spell mastectomy. How am I supposed to know what the right treatment is? So I asked questions. I asked questions, what does this mean for me? I asked questions about what I'm supposed to know. And I knew that I couldn't do this alone, and that I needed to build this army behind me that was going to help me figure out what this journey was going to look like. So I started to ask more and more and more questions, and it continued to build. And I guess that's how the road to advocacy became. I don't think you really set out saying, I'm going to advocate for X. I think you ask a question and you hear the answer, you ask why, and then you start to say, well, maybe this is really the way it should be. So I kept asking the what's, the who's, the whys, and then it all started to make sense to me. So my journey landed me with HER2 positive breast cancer. I felt a large tumor on my breast, and I went in and had the lumpectomy, and when I had the biopsy done, they identified it as a small portion being invasive, but HER2 positive. So if anybody's been in that situation, I cannot tell you how ironic it was to hear so many positive things about a friggin' tumor in your breast. But everybody kept saying to me, this is fantastic, you have HER2, you get Herceptin. This is fantastic, targeted therapy, you are set up for success, it'll be great. So for me, I was like, all right, well, this may not be so bad, maybe we're in a good place here. So I continue along the journey, and I meet with my oncologist to discuss treatment options. And so, the discussion talks about 6 cycles of chemotherapy, you'll have to have radiation, and we're going back and forth. And I can't remember if he brought it up or if I brought it up, but somewhere Herceptin came into the discussion. And we talked about success rates with Herceptin and positive treatments and things like that. And I said, okay, great, when does that come into play? And he sort of looked at me and he's like, I don't really know how to say this. And I'm like, what? Like, did I do something wrong already? Am I asking and I'm not supposed to? And he said, actually, I can't give you Herceptin. And I said, well, what do you mean? And he said, well, so here's the deal. In Ontario, the size of your tumor is actually too small to qualify for coverage of Herceptin in Ontario. So all of a sudden you're hearing things like, just a second, my tumor's too small, I caught this one too early, and that was sort of the key indicator that something really, really, really wasn't going to be right. So I, broke down in tears. And I said to him, but what should I do? Like, what's the course of treatment for me? And he said, look, it's a really tough one for me. He said, it's going to cost you $50,000. And I said, okay, but what do you recommend? And he said, well, I can't do that. Like, I said, okay, just like we fought, and I said, just tell me, money is no object. He said, money's not no object. And I said, humor me, money's no object, what should I do? You should be on Herceptin. And I said, thank you very much. And I left his office. And this is really where the advocacy journey begins. So now I started to assemble the facts and information. I started to call anybody and everybody I knew. And what I quickly found out was Herceptin was indeed the drug for my type of cancer. What didn't make sense was that in Ontario, if your tumor was under 1 centimeter in size, they didn't qualify for funding in Ontario. If you lived in BC, if you lived in Alberta, if you lived in Saskatchewan, you were covered. If you lived in Quebec, they evaluated it on a case-by-case basis, and in fact, I went to the head of the hospitals in Quebec, and my case would be funded. All of this is to say, I think you should be on Herceptin. And so now I was faced with this situation. So now I have all of this information that's pointing the facts really in my favor, but how the hell is this one person gonna make herself heard? Now I have a loud voice and I'm pretty stubborn, but this was a different task. Like, this was a pretty intimidating journey for me, and I really didn't know what to do. So I spoke to as many people as I could who were on my side, like my oncologist here at Princess Margaret was on side with me, and I started to look at the friends in the community, and what I was starting to realize was how connected the breast cancer community was. So now I was starting to feel like the odds were weighing in my favor. One of my friends said to me, she's like, okay, so here's what you've got to do. You've got to be on Twitter. This is where you're going to get all of your help. So I was like, what? So I set up my Twitter account, not really knowing what I'm doing, and I was like, okay, my husband's on Facebook, we'll start doing a page there as well, and we'll start to put this all together. So I have a background in communications, and so part of what I did was researched in the media what was being covered as it related to my medical history. About 5 years before my treatment, there was a reporter at the Globe and Mail who was instrumental in bringing Herceptin to Canada. So I emailed Lisa Priest and I said, we're in another situation here. Here's a story about some inequality that's happening across the country. So much for national healthcare coverage. In fact, I'm being treated very differently simply because of the place that I live. So I made a meeting with her, and 3 things happened on that day. So I spoke with the reporter and I told her my story, and she said, absolutely, we're running this one. She asked me if I was on Twitter, so of course I was like, yeah, I'm on Twitter. Who isn't on Twitter? And that's how I was going to hope to amplify my story. And then I got copied on this email from my sister, God bless her. She sent an email out to everybody in her network and then some, telling my story and what was going on with one call to action. Follow Jill on Twitter. Okay, so now all of these people start getting all these messages saying, John Smith is following you, Sue is following you, and I'm like, I don't have anything to say, I don't know what I'm supposed to do here. So already it's starting to build and I'm starting to get a little bit nervous. So really what happened next is what I like to call the whirlwind effect. So the next day or 2 days later, Globe reporter a photographer comes to the house, takes our picture, and this story runs in the Globe and Mail, Ontario woman's tumor caught too early to be treated. Those were my messages because that's how I felt. I felt like the system was not looking after me and was not really embracing early detection, early diagnosis, and we were in trouble. She also called out the fact that I was on Twitter. And the morning of, I remember I called my dear friend Catherine, who had told me to get on Twitter, and I said, Catherine, here's my username, here's my password, can you retweet the article, because I don't know how to do this. So Catherine maintained control of my Twitter handle for a little bit to help things going, just until I knew what was going on. And then really things started to get a lot busier, and there was some more media coverage. People like John Tory at CFRB at the time, and Matt Galloway, who's on Metro Morning, really made me my mission. The Globe continued to run story after story after story, and they were behind me advocating for it. But so much of it was just like the people that were in my network. I had attracted like a breast cancer organization called Rethink, and they created an online petition to really hammer Deb Matthews, the health minister, to make change and do something about this. Because really, this wasn't about giving me treatment. This was about saying, first of all, there's something wrong with the system if you're not recognizing change, things that are being treated differently in other provinces, but also that it wasn't just about me. It was all of these other women that were coming behind me. I got some backlash from people saying, like, needy little woman, like nothing's good enough for her, she needs to have the best of everything. And in fact, the doctors were saying, like, if she doesn't get cured, she's going to be back in the medical system, and then that's going to cost the system anymore. And quite frankly, selfishly, I had 2 little kids at home. And I wasn't 75 years old having a recurrence of cancer and now trying to figure out how I was being treated. Something wasn't right here, and I needed to know that I was getting the best treatment. So the volume continued, and there were a series of articles that ran in the Globe, and things went on and on and on. And really what I learned in this journey was that most of the work came up front during the diagnosis phase. And you know, when I look out in this room, I thought, I'm going to get up here and they're going to be like, what is she talking about? I'm going through cancer, I'm dealing with this, I'm not going to create this big advocacy journey. And for me, I had the same thing. I was like, I had been working full time, so I stopped working when I got diagnosed. I had a husband, I had 2 kids at home, and I was like, I can't take on anything else. So I knew I had enough. And then I didn't set out on this journey intentionally. I just started asking questions. It's not really about how you advocate, it's about asking the right questions. And so much of the discussion today has been about empowering ourselves and really asking the right questions and working with other people. And that's really, if you look at it, if I hadn't asked what the right treatment was, if I hadn't asked why it was the way it was, if I hadn't asked who had access to different treatments, none of this would have come about. And I didn't ever just do it for me. I went on this journey because I knew I had a daughter at home that, God forbid, one day might face this. I have 2 sisters, I have a mother, I have aunts, I have friends. And there are so many other people that don't know to ask questions. There's this stigma, we talked about stigmas earlier on in the day, there's this stigma of accept what is told of you and don't question authority. And in fact, the opposite is true. Question the authority, question the research, question the reports, and find out what's right for you. I also heard a lot of talk today about how every situation is unique. Well, my story was very unique compared to other people because they're not used to a 34-year-old woman being in the system. So maybe that needed to be looked at differently as well. So I think there's really an important point to really just look at all of the facts and question everything that's out there. The community of supporters that I found on Twitter, the number of people that just reached out to me, complete strangers. I would get messages afterwards with people on Facebook that were in similar situations. There are people there to support you if you want to ask more questions. There are people that will help you ask the right questions. And I never really set out to advocate anything, let alone make change. But the reality is, I did. I got a call the night before my Herceptin treatment was to start, and it was my oncologist calling me. It was about 7 o'clock at night, and Dr. Bedard comes on the phone. He says, Jill, it's Phil Bedard. I just got off a call with the board, and you did it. And I was like, what do you mean? And he said, tomorrow morning you'll be in the chair, and they're going to be giving you Herceptin. You'll be the first patient at Princess Margaret in Ontario to be treated for your tumor size. But the story gets even better. I had asked enough questions to provoke Cancer Care Ontario and the minister to take a look at why I wasn't being covered. And the fact was, they didn't have enough research to justify all size tumors. They start with the bigger ones and then they work their way backwards. So this provoked change at the table at Cancer Care Ontario, where Deb Matthews then said, we're going to take a look at other drugs in this situation. So this is no longer about Herceptin. This is now about all drugs and creating a research-based program. So it's to say that if you have a certain type of cancer and this drug might work for you, we're going to cover it in the system. And so we talk so much about people, insurance, and not being able to afford things. This meant OHIP was now going to be able to cover the treatment and make sure that we're able to be treated the way for the best ability. So this was a really big change for me. This was probably the most moving part of the whole journey for me, was to know that I wasn't just doing this for me. Herceptin was going to be available for all patients in my situation going forward, regardless of tumor size. And then I got a call probably a couple of months after I was going through treatment, and it was a cousin of my father's, and she said, I just wanted to call to say thank you. And I was like, it's not her birthday, I didn't send a card, what's this? Her husband had been diagnosed with leukemia. And in the doctor's office, the doctor said, I have one treatment left to try on you. And this one was just announced 6 weeks ago as part of this research-based funding program. So this one wouldn't have been available to him before, but because of this policy that they had made change, this was going to be now available for him as well. And so thanks. So I think it's really about, really just being able to take a look at what's going on within your own situation and asking the questions. Like I said, I was really intimidated to come up here looking around this room and knowing that people are going through treatment, people are not well, people are sick, people are tired, people are overwhelmed with the fact that it's cancer at all, let alone setting out on this advocacy journey everybody keeps talking about. And I think advocacy happens unintentionally if you are informed and asking the right questions. And that's really my message is take a look, go in with paper and pen, take somebody with you and ask the questions and ask more questions. Each time you get an answer, keep going and keep asking more questions. And that's my story.